Have you ever wondered why acne isn't just limited to our faces? It's a question that might have crossed your mind as you grappled with the pesky problem of pimples popping up in places beyond your face. Let's dive into the prevalence of a particular kind of acne that doesn't always get the spotlight but is surprisingly common. Back acne, or as it's often referred to, bacne. Just like the acne on our faces, bacne is the result of clogged pores. But in this case, it's the pores on our back that are the culprits. They get congested with a cocktail of oil, dead skin cells, bacteria and sweat, creating the perfect storm for breakouts. Now, you may think that back acne is a rare occurrence, something that only a few unlucky souls have to deal with. But the reality is quite different. Back acne is a widespread issue. In fact, about half of the people who experience facial acne also have to grapple with breakouts on their back and upper body. That's right, every other person who's dealing with acne on their face is likely also tackling bacne. But why is it so prevalent? Well, our back has a high concentration of oil glands, much like our face, which makes it a prime target for acne. Add to that the fact that this area is often covered, creating a warm, moist environment that's a breeding ground for bacteria. And you start to see why back acne is such a common problem. However, the prevalence of back acne doesn't make it any less frustrating to deal with. It can be a nuisance, causing discomfort and even pain in some cases. But more than that, it can impact one's confidence, especially during the warmer months when back-bearing clothing and swimsuits are the norm. So, as we peel back the layers on this prevalent skin issue, remember this. Back acne, while common, can be a nuisance and impact one's confidence. But knowledge is power, and understanding what causes back acne is the first step towards managing it effectively. What triggers these unsightly breakouts on our backs? The factors contributing to the development of back acne are numerous and can even intertwine, creating a complex web of causes. Let's unravel this web and delve a little deeper into each one. Firstly, oil production. Our skin naturally produces oil, or sebum, to keep itself moisturized. However, when the body produces too much oil, it can clog the pores, creating the perfect environment for acne to form. This is especially true for the back, which has larger pores and more oil glands than other parts of the body. Next, we have dead skin cells. Our skin is continually renewing itself, shedding old cells to make way for the new. However, when these dead skin cells aren't effectively removed, they can build up, combining with excess oil to block the pores and lead to acne. Thirdly, bacteria. The bacterium Propionibacterium acnes is a normal inhabitant of our skin but becomes problematic when it multiplies within blocked pores. Here, it causes inflammation and redness, resulting in the formation of acne. Hormones also play a significant role. Specifically, androgens, the male hormones present in both men and women, can stimulate oil production and lead to acne. This is why acne often worsens during puberty, pregnancy, or certain phases of the menstrual cycle. Finally, let's talk about diet. While the link between diet and acne is still a topic of ongoing research, some studies suggest that certain foods, such as dairy and high glycemic index foods, might contribute to acne formation. So there you have it. The development of back acne can be attributed to a combination of oil production, dead skin cells, bacteria, hormones, and potentially diet. It's a complex interplay that can vary from person to person, making back acne a truly individual experience. Understanding these triggers can help us better manage and prevent back acne. So you have back acne, what can you do about it? Well, the good news is that there are multiple treatment options available, both over-the-counter and prescribed by dermatologists. Over-the-counter treatments are ideal for mild to moderate cases of back acne. They often contain ingredients like salicylic acid or benzoyl peroxide, which help to unclog pores and reduce inflammation. Salicylic acid works by exfoliating the skin and getting rid of dead skin cells that can block pores. On the other hand, benzoyl peroxide attacks the bacteria that cause acne. Now, if you're dealing with a severe case of back acne, it's time to consider prescription treatments. These might include topical antibiotics, retinoids, or even oral medications. Topical antibiotics work by killing excess bacteria on the skin, while retinoids help to prevent pores from becoming clogged. Oral medications such as antibiotics or isotretinoin are typically used for persistent or severe acne that doesn't respond to other treatments. It's important to note that while these treatments can be effective, they're not instant fixes. Patience is key here. You might not see a noticeable improvement for several weeks, but don't get discouraged. Consistency is vital in acne treatment. While choosing a treatment, consider your skin type, the severity of your acne, and any potential side effects. It's always a good idea to consult with a dermatologist to determine the best course of treatment for your unique situation. One more thing to keep in mind, these treatments are for managing and clearing existing acne. They won't necessarily prevent new breakouts from occurring. That's where lifestyle changes and preventative measures come into play, which we'll delve into in the next scene. And remember, no matter how frustrating back acne can be, it's not a life sentence. With the right treatment, it's entirely possible to clear back acne. So don't lose hope. There are plenty of options out there to help you regain your confidence and enjoy the skin you're in. Aside from treatments, what lifestyle changes can help prevent new breakouts? This is a question many of us might have asked ourselves. The answer is simpler than you might think. Let's start with your diet. Consuming a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can go a long way in maintaining clear skin. You see, certain foods can trigger inflammation and hormonal imbalances which are known to exacerbate acne. Processed foods, sugary snacks, and drinks are the usual culprits. Opt for foods high in antioxidants like berries, leafy greens, and nuts. They help in reducing inflammation and boosting your skin's health. Next, let's talk about hydration. Drinking an adequate amount of water each day helps to flush out toxins from your body, which can contribute to clearer skin. Aim for at least 8 glasses of water a day, more if you're active or live in a hot climate. Now, on to hygiene. Maintaining good hygiene is crucial in preventing back acne. When sweat and oil accumulate on your skin, they can clog your pores, leading to breakouts. Showering immediately after a workout or a hot day can help to wash away these pore-clogging substances. Using a gentle, non-comedogenic body wash can also aid in keeping your skin clean without irritating it. What about your clothing? Well, tight-fitting clothes can trap sweat and oil against your skin, creating a breeding ground for acne-causing bacteria. Opt for loose, breathable fabrics, especially during workouts or hot days. Lastly, remember that stress can also play a role in acne. Activities that reduce stress, like yoga, meditation, or simply taking a few moments each day to relax and breathe deeply, can help keep breakouts at bay. To sum it up, preventing back acne isn't just about what you put on your skin, but also about what you put in your body and how you treat it. A few simple changes to your everyday routine can make a world of difference in preventing back acne. What are the possible impacts of back acne on our skin? This is a question that's often overlooked but carries significant importance. Back acne, or bacne as it's commonly known, doesn't just disappear without a trace. It can leave behind reminders in the form of post-inflammatory hyperpigmentation, or PIH, and scarring. Now, what is PIH exactly? It's a fancy term for the skin discoloration that occurs following an inflammatory wound, such as a pimple. It's the skin's natural response to inflammation, and it's more common in darker skin tones. These dark spots can be stubborn, sticking around long after the acne has cleared up. Scarring, on the other hand, occurs when the skin's deeper layers have been damaged. Acne scars can take various forms, from deep pits to wavy, angular, or rolling appearances. They can be a constant reminder of past breakouts and can affect a person's self-esteem. But here's the good news. There are ways to reduce the appearance of both PIH and scarring. Certain over-the-counter products containing ingredients like retinoids, vitamin C, and alpha-hydroxy acids can help. They speed up skin cell turnover, fade dark spots, and stimulate collagen production to smooth out scars. For more severe cases, professional treatments like chemical peels, microdermabrasion, and laser therapy may be recommended. However, it's important to remember that these treatments are not quick fixes. They require time and consistency to work effectively. And while they can improve the appearance of PIH and scars, prevention is still the best approach. This is where the importance of continuous acne skincare treatment comes into play. By keeping acne under control, we can prevent new blemishes and consequently new PIH and scars from forming. While back acne can leave its mark, there are ways to reduce and manage these skin changes. It's about understanding our skin, treating it with care and seeking professional help when necessary. Remember, every skin journey is unique and what works for one person might not work for another. But with patience and persistence, we all can work towards healthier, clearer skin. When should one seek medical guidance for their back acne? This question is pivotal in the journey of managing and treating back acne, or bacne as it's often called. It's important to remember that occasional blemishes on the back are not a cause for concern. They can be the result of a myriad of factors like hormonal fluctuations, stress, or even a reaction to certain fabrics or detergents. However, if you're regularly struggling with controlling bacne, if the breakouts are frequent, severe or distressing, it's time to consider seeking medical guidance. Bacne, much like facial acne, can be stubborn and persistent. If over-the-counter treatments and lifestyle changes aren't yielding the desired results, or if the acne is causing significant discomfort or distress, a healthcare professional can provide additional treatment options. Consider this. Dermatologists are trained in treating all types of acne. They can provide a comprehensive treatment plan that addresses not just the acne, but also the potential scars and post-inflammatory hyperpigmentation, or PIH, that can result from severe or untreated bacne. Another important sign to keep an eye on is the presence of large, painful nodules or cysts. This could be indicative of a more severe form of acne, called cystic acne, which can cause deep, long-lasting scars if not treated properly. Also, if you notice that your acne is accompanied by other symptoms like excessive hair growth, menstrual irregularities, or sudden weight gain, it could signal an underlying health condition, such as polycystic ovary syndrome or PCOS. In such cases, seeking medical guidance is not just recommended, it's essential. In conclusion, don't wait until your back acne becomes a severe or distressing issue to seek help. Early intervention can prevent potential complications and pave the way for clearer, healthier skin. Remember, it's not just about treating the acne. It's about managing your overall skin health and well-being. Don't hesitate to seek professional help if your back acne becomes a persistent issue. You've got questions, we've got answers. First up, does diet affect back acne? Well, while there isn't a one-size-fits-all answer, we do know that certain foods can exacerbate acne for some people. Foods with a high glycemic index like white bread, sugary drinks and pastries can trigger hormonal fluctuations and inflammation, leading to breakouts. So if you're battling back acne, it may be worth experimenting with your diet. Next, can exercise cause back acne? Interestingly, while regular exercise is fantastic for overall health, it can contribute to back acne if you're not careful. Sweat can mix with oils and bacteria on the skin, leading to clogged pores, the precursors to acne. But don't let this deter you from working out. Simply showering immediately after exercise and wearing breathable clothing can help keep your skin clear. Another question we often hear is, can stress cause back acne? The answer is yes. Stress doesn't directly cause acne, but it does trigger the body to produce more hormones such as cortisol, which can lead to an increase in oil production. And as we know, more oil can mean more acne. And finally, can back acne lead to scars? Unfortunately, yes. Especially when acne is severe, or when pimples are popped or picked at, scarring can occur. But there's good news. There are effective treatments available to reduce the appearance of these scars. So, if you're dealing with scarring, a dermatologist can help you find a solution. Remember, knowledge is power when it comes to managing and preventing back acne.